As the saying goes, attitude is everything. And researchers at the University of Rochester have discovered that a parent's attitude about medication can hurt kids with asthma. 13 Wham's Jen Markin tells us what parents and doctors can do to make sure kids are getting the drugs they need.
5-year-old Marquise Hodrick of Rochester was diagnosed with asthma at birth. He used to only use an inhaler when he was having an attack, and he was sick all the time.
We had to keep taking him back and forth to the hospital. When his attack do come on, we have to carry him back and forth to emergency.
But last year, when he started using a steroid medication every day, even when he was breathing fine, his attacks became much less frequent.
Since he was taking this thing, last year, he didn't go to the hospital that much. As a matter of fact, I only think he went to the hospital like 3 times.
While the Hodrick family was willing to try any drug that might make Marquise feel better, some parents are scared or skeptical of giving their child a steroid. And that reluctance might explain why some children suffer needlessly.
In a study published in this month's Pediatrics, researchers at the U of R found 1 in 6 parents allowed their concern over medicating their child to affect how often they gave their kids the drugs.
They hear the word steroid and it makes them nervous. So we want to reassure them that it's not the same as an anabolic steroid or a muscle-building steroid. The other thing that we hear is we worry about dependence. Parents worry about their child becoming dependent on the medications.
But rather than withhold medication, parents should always discuss any concern with their child's doctor.
As a pediatric provider, I think the main message is that we need to talk to families, find out what their concerns are, and address them the best that we can so that they feel comfortable with the treatment plan.
A treatment plan like the one Marquise is on that has greatly improved his quality of life. In Rochester, Jen Markham, 13 Wham News.
Researchers also note that sometimes parents assume that wheezing and attacks are part of the disease. But with recent advances in medications, doctors emphasize that most children can now live with asthma symptom-free.